Now I just want to start by welcoming Dr. Angelica Lee. So Angelica is a clinician and a scientist committed to improving the standard of care in macular disease. She has a passion for technology, collaborative care and clinical research. Her PhD thesis was entitled Multimodal Imaging in Age-Related Macular Degeneration, and she has had a number of peer-reviewed papers published in leading journals. Angelica is an enthusiastic educator and receives regular invitations to present at both Australian-based optometry conferences and also international conferences, including ARVO and the American Academy of Optometry Conference. So now I'll hand over to Angelica to give the presentation.
Thanks, Natasha. I trust that everything's working as it should. In either case, you let me know if it's not. All right, so I'll take it away. Great. I just want to disclose before we begin that the organisation where I work, the Centre for Eye Health, is a joint initiative of UNSW Sydney and receives primary funding from Guide Dogs New South Wales ACT. We also have an affiliation agreement with the Macular Disease Foundation Australia, hence I'm here, and I'm a named inventor on a technology that's designed for kind of improving the diagnosis of macular disease using advanced imaging. So before we begin, so we know that we're not kind of playing and trying to teach to an empty room, I thought it'd be worth kicking off with some, just a small series of 3 poll questions. This I think will help my role as a presenter in knowing kind of who I'm speaking with. And I think hopefully you'll also, as a listener, benefit by prompting you, getting you to think or self-reflect on some of your own health knowledge and behaviours. If you do choose to participate, be aware that the answers are completely anonymous, and we will be sharing the group's responses immediately afterward. So first poll question, and you'll be Niamh helping me with admin support here. I think she's opened the poll. The question is, how good would you self-rate your knowledge of AMD? Is it A, excellent? Is it B, very good? C, good? D, fair? Or E, poor? It's great to see we've got a lot of quick fingers already responding to that poll. So I'll give you a little bit more time, but it looks like about a quarter of everyone online has already voted. Nice to hear. Nice to kind of virtually hear or see that you guys are online. We're still getting some responses, so I'll keep that open a little longer. Awesome. Okay, but I can see now, I think it's worth closing the poll now at this time. I think we've got a clear majority showing that yeah, 44% of you as audience members are self-rating your knowledge of AMD as good. That's great to hear. We do have room to grow though, and so I'm hoping that by the end we'll be able to boost that even more. So do give us feedback and let us know how this goes. Poll question 2. To what extent do you agree with the following statement, that as a person with AMD, my macular condition will have a negative impact on my day-to-day life? Do you strongly agree with that statement? Do you agree with that statement? Neither agree nor disagree. D, disagree, or E, strongly disagree. Again, I'll just let the answers flow in until we get a really clear kind of majority response. I've done one of these talks before, and I really like doing it in conjunction with the Macular Disease Foundation Australia, because you guys have just such great engagement. It's really nice to see how you're responding this way so actively. Yeah, so we'll cap it at that point, I think. Actually, we're getting pretty even, 37% both kind of were split between agree or neither agree nor disagree. Okay, and third poll question. How often do you intend on having your eyes examined by an optometrist? Is it A, more than once a year? Is it B, once a year? C, once every 2 years? D, once every 3? Or E, less than once every 3 years? I do hope you're trying to answer as honestly as possible as well. Don't be biased by the fact that I am an optometrist. I promise I will not take your answers personally. Okay, great. So majority have voted. Looks like the majority would see their optometrist, 64%, I should say, 64% majority would see an optometrist once a year. Awesome, thank you for that. All right, so I think it's time we kick off. So hopefully you can, you're back to seeing my slides. Again, maybe Tash and Niv, let me know if you can't. But let's begin. So I want you to imagine as the audience for a moment, what I think is an all too familiar scenario, particularly if you're a patient with AMD or if a loved one of yours has AMD. It's a story I think of going in for what you thought would be a routine eye test just for new glasses. Aside from this usual kind of general gradual deterioration of your vision, you weren't experiencing or expecting anything else to arise. But then this dreaded moment pops up where you're advised by your optometrist that you have the beginnings indeed of a condition called age-related macular degeneration. Your mind starts racing, fear and anxiety start to settle in, and several questions come up in your minds. You wonder, can you really trust this doctor? Maybe you should have gone to see your aunt's eye doctor instead. Her eyes seem to be doing really well right now. The other questions come up, things like, how possible maybe is it that this person talking to me is actually wrong? After all, at my last eye test just a year ago, I was fine. I don't feel any different today. The worst question of all, you wonder, does this mean I'm going blind? At this point, you feel that you know very frustratingly little about macular degeneration, but you have heard in the news that it's the leading cause of blindness in Australia, and you worry whether you'll be able to cope. So I'm very conscious, in preparing this talk, I was very conscious that getting diagnosed with AMD does place you as a patient in this really incredibly vulnerable position. It can feel like you're standing at the top of really a huge cliff looking down. But know that me and other health professionals really are here to help. So my first real take-home message, I hope, from this talk is to be aware that we and your healthcare professionals are all here to guide you. Secondly, and most importantly, if you do encounter this point of being diagnosed with AMD, stay calm. Because although it is true that AMD is indeed the leading cause of vision loss in Australia, the condition is also incredibly common. For example, according to the Blue Mountains Eye Study, 98.8%, that is virtually 100% of all patients over the age of 49, had AMD-like changes in the back of their eyes. And yet, if you think about it, the vast majority of older Australians do retain really good vision lifelong. As well, advanced AMD does affect central vision, and although yes, that is incredibly important component for our activities of daily living, there are coping strategies that you can develop with the aid of others. For example, using other aspects of your overall vision, like your peripheral vision, to read bus numbers through a technique called eccentric fixation. Alternatively, modifying the environment so that the sight loss due to AMD doesn't have to have such a dramatic impact on your day-to-day life. A second key take-home message of my talk is to think about your role as a patient or as a healthcare consumer. And on that point, a myth that I really want to dispel is this idea or this notion that the doctor is God or that the healthcare practitioner knows everything. We don't have all the answers, but we're absolutely, as I said, here and on board in helping you through your journey with AMD. So on that topic, just to really, again, dispel this myth that the doctor is God, I want you to consider some key statistics that came out of two key papers published just 3 years ago, in fact. So point one is that 1 in 4 people with AMD actually had that diagnosis missed at their last eye test. So this came out of a really nice study conducted in Alabama where 649 patients, all who had had their eyes tested recently with a mixture of health professionals, had retinal images taken and then graded by experts. And like I said, interestingly, 1 in 4 actually had that diagnosis of AMD missed. They otherwise would not have known about it. From a survey of over 1,000 participants, this study was conducted by the UK equivalent of the Macular Disease Foundation Australia. They found, surveying their patients, that 1 in 4 were dissatisfied with their last eye test. 1 in 3 felt that their healthcare professional was not interested in them. And 1 in 10 were left sadly unaware of the name of their macular condition despite receiving an eye test. And although we have access to a world-class healthcare system, I think it's important to be aware that it's not perfect. That same healthcare system has also been described as fragmented. And it's not unusual, especially patients over the age of 50, to be seeing multiple healthcare professionals all in 1 year, many of whom may not be talking to one another. So I open with these statements. I provide you with this information, I hope not to scare you, but really to prepare you and to really get you thinking hard and long about what the kind of patient you want to be and what your role as a patient with macular disease, or knowing someone well with macular disease, what your role will be as you navigate this healthcare system. And a key quote that comes to mind for me is one by Albert Camus that says, "Don't walk behind me, I may not lead. Don't walk in front of me, I may not follow. Just walk beside me and be my friend." And really, so that summarizes, I think, the key take-home message of this talk. Firstly, that optometrists and other healthcare professionals, we're your partners in eye care. And it's really my hope that after listening to this talk, you'll feel considerably more empowered to make a change in your life and to kind of improve your position as somebody with, or as knowing somebody with AMD. So with that background out of the way, I have structured my talk for your information into 4 different sections. I'll begin with by touching base about what a typical eye exam conducted by an optometrist involves. I'll secondly describe a concept known as health literacy. Thirdly, I'll look at what an optometrist can provide, and finally answer some frequently asked questions. The learning objectives from this talk are to understand the role of optometry in each stage of AMD. Secondly, to appreciate the scope of practice of different eye care professionals with respect to age-related macular degeneration. And thirdly, to gain knowledge with the view of gaining an improved patient experience. So first section, without further ado, I'll now cover kind of what a typical eye exam as performed by an optometrist looks like. And in general, we're trained to structure the eye test into 5 key components. And I'll be going through each of these next. So firstly, the case history, and this really is the opportunity for you as a patient, as an individual, to express the key problems you're having either with your eyes or your sight. In other words, it gives you that chance to clarify why you've come in. As an optometrist, I think you can expect me to be hopefully helpful, supportive, and highly informed. As a patient, and provided we've both put in the hard work to develop a good relationship, I would hope that you would be clear with your answers or with your concerns, accurate or as truthful as you can be, and also responsive if I'm asking questions and trying to gather more information to help you. The second part of the eye test, and this does vary quite a bit from practice to practice or patient to patient, is what's often described as preliminary or entrance testing. So these are kind of really simple kind of entering activities or tasks that we might do to gather a bit more information about your eyes and your vision. So as an optometrist or as healthcare professionals, we're often trained to think of your kind of chief complaint, as it's described, as a mystery to be solved. And so this preliminary or entrance testing really forms the beginning of our search for evidence or data, or the data gathering process tailored to understand that complaint more. So as I said, it is personalized and it does vary significantly from person to person, from optometrist to optometrist, from practice to practice. For example, the common entrance tests relevant to AMD I've listed on the slide here. And it is quite jargon heavy. I don't expect you to remember any of this, but if in doubt at this point, or at any point really, through the eye test, remember you can ask. I think it's, I really want to emphasize that it's important that as a patient, you are in a position where you can ask questions. The eye test should be a safe environment at all times. No question is too dumb to ask, for example. Third part of the eye test is the refraction, and the aim of this, you'll often be seated, you probably know it well, you're often asked to read the letter chart several times, and you're seated behind this big gadget, which we call a phoropter. And the aim of this part is really to kind of identify the best combination of lenses to give you what we describe the best corrected visual acuity. In other words, what's the best achievable vision you can get given your eye health state. This is also an opportunity where you might have brought up things like the way you like to use your vision for instance, at work or at home, what activities you like to engage in. And it's important we know about that so that we can tailor the refraction or ultimately that lens prescription we would give you to those activities. So as I say on the slide here, the typical output really is a prescription in that traditional sense for glasses. Fourth component of the eye exam is the ocular health exam. Ocular is really just a fancy word for eye. And do remember to please be patient here. There is a lot to see. I know the eyeball itself seems like a small organ. It's only 3 centimeters long, but it's an incredibly detailed one. In fact, you know, the retina in particular is often seen as a continuation of the brain. So if you think about it like that, it's highly complicated. Your pupils will often be dilated, so we'll be using typically eye drops that blur your vision for a few hours, leave you a little bit light sensitive, and you may be advised not to drive away after the eye test. And the purpose of that is really to open up the pupil to give us the best view into the back of your eyes and to the macula, so we can really be thorough and comprehensive in doing our jobs best. This part of the eye test, the eye health exam, is aided a lot by additional tests like imaging. So you might have seen one of these types of gadgets or gizmos in the practices you frequent. And my top tip here is that really anyone with at least the medium grade of age-related macular degeneration, or intermediate stage as it's better described, does need to have or should have retinal photography and an optical coherence tomography scan done at least once a year. Who that's with, it could be with an optometrist, it could be with an ophthalmologist, it doesn't matter. But I think as a minimum, it's important that you do have those tests done regularly to best review your eye health overall. And on that point, I think it's my opportunity here to put a cheeky plug in for the organisation where I work, as I said, which is the Centre for Eye Health. And we were really developed with this primary goal of reducing preventable blindness. So if you're not able to access these imaging services, either your optometrist doesn't have the equipment in their stores, or you can't afford to do these tests, then I highly recommend that you ask for a referral to see me or one of my colleagues here, because we do provide all these services, these additional imaging tests free of charge. We're based at the University of New South Wales, but we do have 2 other locations, one at the Sutherland Hospital and also one in Parramatta in conjunction with Westmead Eye Hospital. So we do see on average 9,000 patients per year, and we do offer, as I said, access to advanced imaging, in fact, over 20 plus state-of-the-art imaging devices. And of course, we don't expect to use all of those. It will depend very much on your reason for being referred. The other thing, one of our satellite clinics, in fact, was opened just earlier this year, and the whole goal of it really is to offer what we describe as a more integrated care service. So the benefit of this type of clinic is that we also have, in conjunction with working with kind of ophthalmologists from the Westmead Eye Hospital, we also have Guide Dogs New South Wales ACT staff on site. So if we do need to kind of refer you onward for low vision support, then that can also be arranged. I'll explain a little bit more about this referral pathways concept soon. But returning back to those 5 components of the eye test, so I've already explained, so part 1 was the case history, part 2 was entrance or preliminary testing, part 3 was the refraction, 4 was the eye health checkup. Now finally, it's time to wrap it all up, to conclude and to really give you kind of the key messages about your own eyes and your own eye health. And really, this is your time, I think, to shine. It should be an open dialogue, and it can be helpful at times to involve a carer, friend, or family member, often that you trust. I'm guilty, probably more than most, of trying to give my patients too much information because I find the eyes just so interesting. But I do try to tone it back, and I think it is important that you as a patient tries to clarify and make sure you understand the key messages. So if you want, I think a tip I have for you is to kind of oftentimes at the end of every health appointment that you have, be it with a GP, with an optom, with an opthal, I think my tip to you would be at the end, take a moment to really clarify or recount what the key messages you understood from that test were. Recite them back to the healthcare professional and ask them if you understood correctly. That will give you a chance to kind of clarify any misunderstandings if any came up. So it is, as I said, really the opportunity to clarify next steps, any required follow-up, if a referral to other professionals is required, and also the role of any outgoing reports if we need to do that. This is a chance for you to take control, as I said, of your own health overall, and to seek advice from different sources. I do encourage you as well to ask questions, especially when you don't feel heard. So in terms of referral pathways, so this describes kind of who should be involved, because I understand that with our modern healthcare system, it seems like oftentimes there are often too many options. But depending on the stage of your macular disease or your macula generally, if you have dry age-related macular degeneration, for instance, generally you'd be recommended to see an optometrist alone, whether or not that's with or without other support organisations like the Centre for Eye Health for imaging. If you have wet age-related macular degeneration, it's important typically that you're seeing an ophthalmologist regularly, and usually that would be for injection treatments or something similar. If you're looking for further information or support on the condition or lifestyle change, then the Macular Disease Foundation Australia is definitely your best bet. And finally, if you're looking for low vision support, or you're trying to, what's also been described as vision rehabilitation, or you're looking for some really practical advice, you're struggling with your vision and achieving your daily goals, then I think it's important to look at groups like Vision Australia or Guide Dogs New South Wales, ACT, for support. Bearing in mind that groups like Guide Dogs, they don't provide just guide dogs, they do provide other low vision support. For example, use of canes, environmental modification, access to social services, etc. So the key points from this first section, I've summarized kind of the typical components of the eye test as it's performed by an optometrist. So the key points really that I want you to take away are that as a patient, you are an active participant in the eye exam. Do at all times stay calm, and remember that many patients with AMD do retain good vision lifelong. My course to action, if you're not already on top of it, I really strongly suggest that you record any symptoms or questions you'd like to ask your healthcare professional at your next scheduled visit, particularly those symptoms or problems which you feel have not been addressed. Let's backtrack a little bit. Second call to action is that I want you to consider, are you seeing the best you could be? When did you last update your glasses? And thirdly, do check, especially if you do have the intermediate stage of age-related macular degeneration, do please check when you last had photography and OCT, or optical coherence tomography scans done. So that extra bit of imaging as it's described. Okay, so now second section of my talk, this one is described as health literacy. So I'll be talking now, which I think is really the key to improving your healthcare experience as a patient. So a definition of this first. I know definitions are really dry, but I think this is a really important concept to understand. So health literacy describes your kind of capacity to access and understand basic health information. And that's the reason it's so important, is that it is needed to make appropriate decisions about your health. It can be considered as your ability to understand instructions on drug prescription bottles, your ability to understand appointment slips, doctor's directions, information brochures. And it does have a dramatic impact, I think, on your ability then to navigate the health system as a whole. In other words, knowing who to see, when to see them, why and how to see them. So as a patient, making sure you see the right doctor, in other words, at the right place, for the right care at the right time. And I know that can be really overwhelming and it can be tricky, which is why I think I think that this is a valuable section to add to this talk. So low health literacy has been linked to high rates of death, high risks of preventable adverse events, high rates of hospitalization and the trips to the emergency department, for example, as well as a high incidence of healthcare visits. This list of contributing factors, I think this is especially relevant to audience members who may be caring for patients for other people with age-related macular degeneration. So your health literacy is likely to be lower if you lack educational opportunities, if if you also have any learning disabilities or any evidence of kind of cognitive decline. So now that we're kind of on top of knowing the importance or the value of health literacy, hopefully I've convinced you that it is important. The next logical question that comes up is kind of how do we build it? And really, it's threefold. Good health literacy is really the outcome of having really strong oral communication skills, having good information skills, and thirdly, having good health decision-making skills. And that last one's a big one. Being able to make decisions about your own health often relies, I think, on a high level of kind of self-awareness as to what you value. And it often does involve kind of risk-benefit judgments as well. And this will make a little bit more sense as we go through. So on that note, I thought let's throw in an active learning exercise. So I encourage you, if you've got a pen or paper handy, otherwise if you don't, can go and grab one now. My suggestion then is to take a look at this flyer. So this is a very common example. In fact, this is one produced by the Macular Disease Foundation Australia of a kind of health flyer or brochure that you might encounter waiting in the doctor's office or even around your community generally. So you can see you've got some key messages on the screen there. And so I want you to consider the question and maybe jot down your answer as a way of kind of prompting your self-reflection. So the question I have for you is, who is the target audience? So looking at that, to me, I think this flyer was really designed for patients with macular disease or at risk of macular disease. And it's important that you understand then that if you do fall into any of those categories, that this message is relevant to you. Second question, what's the key message promoted in this flyer? So from the looks of it, again, take your time. I'll share my answer soon. But the key message I think promoted in this flyer is that there are strategies in terms of lifestyle change that you can do to keep your macula healthy. So S standing for smoking suggests that to keep my macula healthy, I might consider quitting smoking. A for age. Now age, of course, we can't change, but what about the other additional kind of what you know can delay aging, like exercising well or eating well? Certainly those are lifestyle factors that I can consider changing. F, family history does place, particularly if there is an increased risk, because there is an increased risk of AMD in family members. It's worth either asking your family members if they have AMD or encouraging them to get their macula tested if you yourself have the condition. And finally, E for eye exams, knowing when and how often to get your eyes tested. And so the last question I encourage you to think about is what, as a result of this flyer, have you decided about your own health? So those strategies, those kind of key messages that might have this relatively simple looking flyer promoted, what have you decided about your own eye health? What would you do tomorrow differently as a result? Next, active learning exercise. I'm going to show you a very short video. It's about 5 minutes long, again, produced by the Macular Disease Foundation. And there are 3 questions I want you to consider as you're listening and watching that video. Firstly, how credible is this information? Also, what clues lead you to either think that the information is credible or isn't? What are the key messages of the video, and where would you go for more information? Okay, so I'll show you this video now and we'll come back to these questions afterward. Hopefully the audio works. If not, I do have a third exercise anyway up my sleeve.
I'm not getting any audio, Angelica. This is just Natasha.
Okay.
Is there any way you could maybe talk through it, or if you have maybe a side speaker that you can connect?
Yeah, good question. I think there was just so much information in this one. I think it's probably worth, what we might do is maybe we'll send it out as a link. How about, can we do that with the resources pack afterward or something like that?
Yeah, we can make something work. Yeah, definitely.
I mean, it is on your website. It's definitely, I mean, it's your content. So awesome. Okay, we might give this one a skip then. So cool, thanks for that. So instead, let's try this exercise. So here is a little bit of text now about AMD. Then for the audience listening along, take a moment to kind of read that. Take your time. Okay, so hopefully you've all had enough time to read that one. But the question then is, according to these paragraphs, what is macular degeneration? And so in a way, of course, the answer is in that first sentence. AMD, also known as age-related macular degeneration, is the name given to a group of chronic degenerative retinal eye diseases that cause progressive loss of central vision, leaving the peripheral or side vision intact. And so there are a couple of key concepts that are definitely worth understanding. So things like, what do the terms chronic and progressive mean, first of all? So chronic, typically, to me, it means long-term, or develops over a long time period. Degenerative is often associated, means that it's a condition often associated with some sort of functional decline or a change in your sight, for example. Progressive means that it tends to get worse. But then other questions can often arise. Does that mean all patients with AMD become necessarily legally blind? And the answer to that is a strong no. So as I mentioned earlier, although AMD is responsible for 50% of all cases of blindness, not everyone with AMD does become blind. As I tried to stress earlier, and that is really a key important point, AMD-like changes do occur in many eyes, in virtually all of our eyes over the age of 49, but not everyone progresses to sight loss. And so that's an important concept to know. So chronic and progressive, I think I've addressed the meanings of that. So I think it's important to think about kind of the credibility as well of the information. So the fact I'm giving it to you as part of this webinar, which has been organised through the Macular Disease Foundation Australia, that gives you a sense in a way of kind of the quality of the information. We can verify that it is accurate as well. It agrees with hopefully other information you've been told in the past. And so that again adds this additional element of credibility or accuracy to the information you're receiving. So the key point from this second section is to be conscious of trying to build your health literacy skills. Like any muscle, like any skill, gets better with practice. So the three key cornerstones to work on are your communication skills, your information skills, that includes where you access information, how you judge its credibility, and thirdly, your health decision-making skills. So reflecting on what's important to you about your kind of own health and how you can convey that to the healthcare professionals who are seeing you and working with you on your health. Section 3, what an optometrist can provide. So this links a little bit certainly to the different components of the eye test, but I think it's worth being a little bit more explicit. So really, again, I've broken it down to 5 different things, what an optometrist can provide. Firstly, it's information. Secondly, optical devices. Thirdly, supplement advice. Fourthly, referrals and reports. And finally, tests for family members. Again, I'll be going through each of these in a little bit more detail now. So firstly, information. And so we are sources of information, I think. As I said, the eye test is definitely a safe environment, or should be at all times. So do don't hesitate to ask questions. And so we can provide information on the condition, and I think more importantly, and also on your personal eye health. So kind of depending on the nature of the changes inside your eye, for example, a person with kind of early to intermediate age-related macular degeneration has anywhere between a 0.5 to 50% risk of sight loss in 5 years. And so that's, I mean, that variety, that diversity in itself is huge, right? It's important to know kind of where you stand, what's your own level of risk. And so that's what I mean by personalized eye health information. Thirdly, an optometrist can give you information on your vision, your own visual needs, and discuss kind of what aids or what type of glasses to use in what settings or environments. As well, we can provide you with some environmental recommendation strategies. Generally, if you're struggling to see the things you want to, it's all about making things bigger, brighter, and bolder in the environment. Whether that might be, for example, by taping a hyper or glow-in-the-dark strip along kind of the walkways in your home, for example. Something as simple as that can really make a difference, I think, in your day-to-day quality of life. Diet lifestyle recommendations, we can certainly provide you with information on and advice on that. There's a lot of interest right now in the Mediterranean diet, for example. And there's certainly, as I said, strong evidence linking that a healthy diet to reducing the risk of progression of disease. Self-monitoring advice, you might have seen the and to the grid as it's kind of shown bottom right here. So that's a really useful tool for self-monitoring your vision for any changes before it's too late. And then review schedule, knowing when and how often to get your eyes tested, as I said, is important. And finally, some information on through the form of brochures or kind of materials like the ones we've already seen and like the one pictured here on the right. Optometrists, and this is the thing we're most well known for, of course, we can provide you with optical devices, things like glasses, contact lenses, and low vision aids or magnifiers, for example, to help you in seeing what you need to. Supplement advice, there are a myriad of supplements on the market for macular health, all of them, of course, with really strong, bold claims on the label. And so it can be hard to know which one's right for you. And so my suggestion is to talk to either your optometrist or your other healthcare professionals about which supplement is best. If you're not sure, you can't remember, you find it hard to remember the names, feel free to bring in a photo or bring in the bottles themselves and we can talk it out together. Also, we can provide you with referrals. So at any point, if, for instance, depending on the stage of macular disease in your eyes, it may be that we involve other professionals or other team members to help with your care. So it might be that an optometrist refers to another optometrist for further testing or imaging, like I described earlier. Alternatively, I might refer you to a specialist be it for treatment or surgery. To the Macular Disease Foundation Australia, I'm a big fan of kind of, with your consent, of course, signing you up to their newsletters because they can be so helpful. And also referring to Guide Dogs or Vision Australia if you do need vision rehabilitation or more low vision support in your day-to-day life. And in the ethos of kind of shared decision making, it is really important that again, that these options are discussed with you. You do have a say, so I suggest just talking about it with your optometrist every eye test you have if it is appropriate. As well, optometrists are great at writing reports. So for things like if you need one for licensing to the RMS, what used to be known as the RTA. As well, if a report to your general practitioner, just so we can keep everyone on the same page, especially if you are starting a supplement or considering any major diet or lifestyle modifications. The GP asking for a report to take to your GP is really helpful, I think. And also to an employer or, for instance, if you're requesting an environmental modification just to make life a little bit easier to see at work, then we'd be happy to supply you with a recommendation or with reports for that reason. And we'll also decide at that point what information is most appropriate to include and you often can ask for a copy as well, so everyone, as I said, understands. Testing for family members as well, more than happy to do this. This is probably, what we excel at doing. Eye tests for anyone who might be at risk of eye disease. So I think this quote that I included bottom right resonates quite well in that, this patient, when they were diagnosed with AMD at their first diagnosis, they noted shortly after that, it didn't mean anything to me, but since then I discovered my grandfather and my aunt and uncle have all had it. So often that, it was a shock to them initially, but then they realized that through encouraging other family members to get tested, they realized indeed how common macular degeneration was in their family line. So the key points here are to recognize that optometrists are healthcare professionals trained in the assessment and management of eye and vision disorders. So we're more than just glasses, I guess, which is a common misconception. We do screen the eye really well for eye health concerns or problems too, and can be really good sources of additional information. And I think that tip applies generally too, to consider all healthcare providers as sources of information. My course action then are to consider, if you don't already have one, find an optometrist today. There is the Optometry Australia website that has a find an optometrist function if you're having trouble finding one. As well, my question to you is to consider, have your loved ones had their maculars tested as well? When was their last eye test? Maybe you can make a day of it and get and all go out together for that reason. Last section now to my talk, frequently asked questions. So first question here, how does an optometrist differ from other healthcare professionals? And so this is the one I get asked a lot. And I know it's incredibly confusing. The names certainly don't help. So you might have heard all of these terms bandied about quite commonly. So orthoptist, optometrist, and ophthalmologist. So let's start with an orthoptist. An orthoptist is, all of these, I should say, are university-trained healthcare professionals, so all can be really good sources of information. An orthoptist tends to work alongside an ophthalmologist, and so they'll often be the ones doing kind of some of the pre-screening work. They may be the ones dilating your eyes using eye drops and checking your vision, but often are located within either an eye clinic or an eye hospital, or in a private ophthalmologist practice, working alongside of them as part of that team. Optometrists like myself, we tend to operate, as I said, oftentimes we're the ones kind of giving out glasses, so to speak. So you'll see us attached, often as standalone clinics, but attached to a dispensary with a whole series of frames on the walls, for example. So we perform eye exams for your vision, as well as for, as I said, screening your general eye health. Ophthalmologists are eye surgeons. So these are the specialists or medical specialists where their bread and butter is all about kind of treating your eye disease if it's present. So often you'll get referred from an optometrist to see an ophthalmologist for treatment. And their day-to-day involves either kind of oftentimes surgery, for example. They'll be the ones doing cataract surgery, or in the case of macular disease, they'll be the ones injecting your eyes for treatment. Next, frequently asked question, how often should I get my eyes tested? And the answer to this one, there's no simple answer, I'm afraid, but it does depend. So how often? If it's normal aging, so if you're not actually experiencing or showing any true signs of age-related macular degeneration, then you should be getting your eyes tested approximately every 3 years if you're under the age of 65, or if you're 65 and above, you're getting your eyes tested once a year. If you have the early to intermediate stages of AMD, then every 6 to 12 months is more appropriate. If you had the advanced or dry form of age-related macular degeneration, then every 3 to 6 months. Alternatively, if it's the wet form or the neovascular form of age-related macular degeneration, often you might be receiving treatments and you're seeing an ophthalmologist. then every 1 to 3 months is probably more appropriate. So you can see that it's a sliding scale, that as the disease severity increases, you should be getting your eyes tested more often. As well, you might be getting your eyes tested more frequently if any of these following reasons apply. So if you maybe had a heap of questions that we couldn't quite address, or a heap of problems we couldn't address in the one visit, so it might be that a follow-up was required. If you're in the situation where you want to wear contact lenses or are suitable for wearing contact lenses, then again, you might have a different visit to address that. Similarly, for low vision support, for what we describe a functional assessment through, for instance, other members of the team, assessing things like your orientation, your mobility around the environment. Binocular vision, so that in essence describes how well the two eyes work together. So if you're struggling, if you're finding you're getting symptoms like double vision, your eyes are fatiguing really easily, then a binocular vision assessment as a separate visit might be required, as well for questions of suitability for driving or licensing needs. Again, that might be done more frequently at a separate visit. Another question, I see an ophthalmologist regularly. Should I still see an optometrist? And the short answer to this one is, I mean, I'm biased, feel free to gather more information, but of course I would say yes. And I think that's important because mainly for the refraction component, to cover aspects of the eye health that the ophthalmologist may not be addressing directly. So as I said earlier, ophthalmologists, eye surgeons, they're usually the ones treating a specific condition. So I think it's important to see an optometrist to address more other general aspects of your overall eye care. I have an eye problem, who should I see? And for this one, I think it really depends. So it depends on your goals, whether or not, you know, what your aim is and reason for raising the concern is. And it depends on the nature of the problem you're having. So if, for example, daily tasks such as reading are getting harder, then I would, as a first port of call, definitely see an optometrist. It may be that your glasses need some tweaking. Maybe, as I said, they might be able to give you some environmental suggestions or advice on kind of the types of activities you're doing to help make that easier. If you're missing objects while driving, or driving at night feels less safe, then you might need to have your vision reviewed in terms of your suitability for driving, either from a licensing perspective, but also from a personal safety standpoint. So we might be able to give you advice on where you sit in terms of meeting the kind of vision standards required for driving. Alternatively, again, it might be improved with the aid of glasses. So seeing an optometrist is suitable for that. It could be that if you have dry age-related macular degeneration, you have these areas of atrophy which are causing parts of your vision, which are causing what we call spots of your vision, where you can't see. And so it's important to know the ins and outs of why that's happening. And I think, again, optometrist is a really good source of further information on that. If your vision seems to fluctuate, or if a new blurry spot appears in your central sight, depending, the answer for this one does depend a little bit. So if your vision fluctuates a little bit, if you're already seeing an eye specialist, or you're already seeing an ophthalmologist and under their regular care, then definitely it's important you see them as soon as a new symptom arises, and they'll often give you that advice. I should add that wherever, in all cases, be guided by what your healthcare professional last advised you. Similarly, if straight lines start appearing wavy or disappear, if you get any new distortions or new symptoms at all, that it is important to see an eye surgeon, an ophthalmologist, if you're already seeing one. So another rule of thumb to consider is that the more sudden the onset of new symptoms, the sooner you should have your eyes tested, and that timing is everything. So it's really important. The sooner new symptoms begin, if it's a sudden change, the sooner you need to be on top of it. If the symptoms are more gradually, if they've been long-standing or they've been there for a long time, generally that means that there is, and this is a guideline anyway, but generally that means you do have the luxury of time. But anything sudden, anything new, do get it checked out as soon as you can. Another frequently asked question, I've heard that there's nothing you can do about AMD, and is that true? And so this one really, really hits home. It's really sad in a sense to see or to hear that patients have been advised that nothing can be done. I absolutely disagree with this statement. It is absolutely a myth, and I can't stress that enough. So, and this is well known in the literature. It's been described in reports previously that a large bulk of patients with macular disease have been told that there's nothing that can be done. And as a result, they felt incredibly anxious, depressed, shocked, or panicked, and even suicidal. So this is a myth, okay? And to debunk that, on this slide here, you can see how much that can be done. So diet and lifestyle advice, it's too much to cover in one presentation, but there is a whole host of things in terms of quitting smoking, protecting your eyes from UV exposure, the aid of supplements, for example, to help delay or reduce the risk of progression if it's suitable for you. Getting members of the family tested so that they get any changes or any macular disease identified early as well. Self-monitoring, again, being on top of those sudden changes is so important. So self-monitoring your vision, whether it is with an arms to the grid or with other methods, is important. If you do have vision loss, or if you're at that stage where your AMD is affecting your central vision, then low vision and rehabilitation support is an option as well. As well, you can get support through your community, either friends, family members, or even through organisations like the MDFA. And of course, treatment if you're in the wet stage of AMD. So, key point I can't stress enough is that vision loss is not inevitable. Vision loss does not mean that your quality of life needs to change. There are coping strategies that we can help support you through developing. So that pretty much brings me to the end. The key points I want to stress from my talk all up, I know it's been a long journey. Firstly, you're an active participant in managing your eye health, so I encourage you to get to be that, to really be empowered and to consider the type of patient you want to be, ask questions actively, be a part of managing your health. Secondly, healthy aging is a reality, and thirdly, that optometrists indeed are here to help, as well as all healthcare professionals. And so on that point, just before I hand back over to Natasha, I want to revisit these 3 poll questions. Niamh, if you're online, I appreciate your help administering these ones. So we're going to readdress those same 3 questions, and I'm curious to see if your majority responses change. So first question, how good is your knowledge of AMD? Same question as before, same response set. So would you say it's A, excellent, B, very good, C, good, D, fair, or E, poor after hearing this talk? I'll give you a little bit longer to get the responses in. Fantastic. Okay, and we might close the poll now. So it looks like the majority response at 45% are self-rating their knowledge of AMD now as very good. So that's a slight improvement. That is an improvement of 1 step from the beginning. So that's great for us to know. Second question, to what extent do you agree now with this statement? So same statement as earlier, that as a person with AMD, my macular condition will have a negative impact on my day-to-day life. Do you A, strongly agree with this statement, B, agree, C, neither agree nor disagree, D, disagree, or E, strongly disagree? Again, I'll just give a little bit longer for all the responses to come in. Fantastic. But again, this is great. I think we are seeing a bit of a difference. So we've tipped at the beginning, I think it will split between B and C, with some of you saying that you neither agreed nor disagree with the statement, you're kind of fence sitting a little, whereas now we're getting a clear majority to agree. And so that's really great to see. I agree. Macular disease shouldn't have a negative impact on your day-to-day life. There are coping strategies that I, as an optometrist and other healthcare professionals, can absolutely help you with. Great. And last poll question. How often do you intend on having your eyes examined by an optometrist? A, more than once a year, B, once a year, C, once every 2 years, D, once every 3 years, or E, less than once every 3 years. Fantastic. Okay, and we can close the poll there. That's great. So it looks like the all responses pretty much are coming in at either once a year or more than once a year. And I absolutely agree with that, particularly if you do have AMD. Okay, so that's it from me. I just want to finish up with an acknowledgement slide to thank, of course, all the staff at the Macular Disease Foundation Australia, in particular, Christina, Natasha and Niv for supporting me in presenting this today. And some of my colleagues at the Centre for Eye Health, Pauline and Michael, who helped review some of the content to this presentation. Thank you everyone as well to the audience. Thank you for listening and being a part of it. It was really great to see your responses and that improvement at the end there. Thanks everyone. I'll hand back to Natasha, I think, to finish up.
Yeah, hello. Thank you so much, Angelica. I think it really just shows the scope of optometry and how they can really be a partner in managing people with age-related macular degeneration. So thank you so much for presenting today. So just a really quick reminder, I know it's 3 o'clock now and this was a set time to finish, but if you did want to have any questions answered, please just stay on the line. We might take another 10 minutes just to get through some of the questions. And again, just a reminder to use that question icon on the right-hand side of the screen to type in any questions that you may have. So we will get to them very shortly. Just really quickly again, because I am conscious of the time, I wanted to talk about some of the work Macular Disease Foundation is doing. So our goal is to reduce the incidence and impact of macular disease. So the first icon there is talking about our prevention and early detection work. So we do this through education sessions and webinars, such as today's session, and also big awareness campaigns that we advertise on TV, on the radio, and also updated and accurate information that we have on our website. We have a support and service channel, so this is through our helpline, but of course all of the free information and support that we have available online. The voice of the macular disease community is alluding to our advocacy work. So we are the national peak body for the macular disease community in Australia. And so it is our privilege to advocate for these people for their best interests. And finally, research and data is talking about our research grants program. So this has been around since 2011. We've raised over $4 million contributing to 21 Australian researchers. So all of this work I wanted to mention is funded by donations from the public. So we're very thankful to all of our supporters, but also from government grants that we do receive. So the number on the screen is of course our toll-free helpline number if you had any further questions, perhaps if there were any that we didn't get a chance to answer today. And of course, the URL on the bottom is our website if you wanted more information or you did want to connect with us. So I will now go to some questions. There are quite a few, so I'll just try and pick and choose the more common themes. So if you want to jump back on, Angelica, and I'll get you to help me to answer them.
Sure thing.
All right, so the first one here. So this person has written in and said, your AMSA chart was yellow lines on a dark background. Mine is black lines on a white background. Does that make any difference?
It's a good question. So the one I presented should actually have been white on a black background instead of yellow. But yes, there is some, I think the original AMSA grid was presented in that way. For printing purposes, most of the versions you'll have or you'll have seen will be black on white. But there is some evidence to say that the white on black one is slightly more sensitive, so slightly better at kind of detecting some of the distortions. But that said, yeah, I think the point remains, don't get too worried about, you know, which version you have. As long as you're self-monitoring your vision, I think that's the more important message, that any items which you know should be straight, any lines which you know to be straight, like on door frames, windows, if they ever look wavy or distorted, then those are indications to have your eyes tested sooner.
Great, thank you. There's a question here that's probably COVID related, so if you can help answer it. So this person's written in and said, I had vitreous detachment during the pandemic period in May. So who should I go to for a consultation? So I guess it's just addressing what services are open at the current time.
Yeah, no, definitely. It's a great question. So certainly with vitreous detachment, my presumption is that it was a sudden change and that you might have been getting symptoms like new flashes or new floaters in your vision, in which case the more important thing is that you're getting your eyes tested and definitely your pupil dilated as soon as you can. So any new sudden onset symptoms like that, sudden flashes, sudden floaters, you should be getting your pupils dilated, and best way to do that in the simplest way, I guess, is locally through a community optometrist, and then they can refer you on to see a specialist if required. So yeah, it will come down, I guess, to what is open, but I think at this point, at least in New South Wales, I'm aware that most optom practices are certainly back to, working. Back to their standard hours.
Yeah, if it is an emergency procedure, generally they are still operating if it is something that needs to be done urgently. So, yeah. We've got someone who's written in and said that your centre, you mentioned it was in Sydney, in Randwick. They're asking, is there a similar centre in Melbourne?
That one we'll have to follow up with you on. Hopefully, do we have the names of the people submitting the questions? We might get in touch with them afterward. I hesitate to name an organisation at this point, but we'll get back to you.
Great. There's a few clinical questions. So this person's written in, when having AMD, can cataracts be corrected? Can you answer that one?
Yes. The short answer is yes. So AMD affects the central retina in the back of the eyeball. Cataract affects the lens, which kind of sits just behind the pupil, kind of halfway through the eye. It's not quite accurate, it's more half to the front. But the point is that yes, you can have cataract surgery if required. So if you feel if you've been advised that, definitely cataract surgery should be done and can be done even if you do have AMD at the same time.
Probably might just do two more questions. So the second last one here, if you're being treated for AMD, don't you need to see an optometrist annually to get a referral to the ophthalmologist?
It's a good point. So yes, definitely in terms of costs. So the reason to get the referral usually is to enable or to activate a Medicare rebate. So yes, so oftentimes it makes sense to involve both parties. See an optometrist anyway for the rest of your eye health and for the vision check, and kill two birds with one stone, get the referral as well, so that when you do see the specialist, the ophthalmologist, that the appointment cost as well is lower with the referral.
Great, okay. And And just one final question. So how do I know which healthcare professional I need to see? You mentioned orthoptist, optometrist, or ophthalmologist. That's a great one.
So the short version is, consider the optometrist like a kind of a GP for eyes. So I would see your optometrist regularly as a first point of call. And then if they notice any, they can then guide you depending on the stage or severity of your eye health. They'll be able to then refer you onward to an ophthalmologist if required.